Catherine Macaulay Nursing School is a leading institution in Kenya offering competitive training in nursing education, innovation, research and professionalism.
We are a nursing school that was started way back in 1972, chartered as a midwifery school. The school is run by a highly qualified faculty. All the departments, for example, you look at midwifery, it's headed by someone with a PhD in midwifery. Critical care is headed by a highly specialized person with a master's in critical care. Nephrology, the same. Our clinical instructors for these programs are also specialized in their various fields.
The school is licensed and accredited by the Nursing Council of Kenya to offer holistic training in various nursing programs.
We have general nursing, that is the Kenya registered nurse. We have higher diplomas in Kenya registered midwifery, Kenya registered critical care nurses, Kenya registered nephrology nurse, and also we have theatre nursing, which is called Kenya registered perioperative nursing. We do admit our students from all over the country, especially for the basic diploma, that is the Kenya registered nurse program. And for higher diplomas, we admit, again, we have a Pan-African presence. We have students from Congo, from Rwanda, from Uganda, and from other countries. But basically, most of our students are Kenyan, those ones who have graduated from our Kenyan institutions.
Enjoy your learning in a friendly environment with adequate training facilities, including a fully fledged skills laboratory, library, lecture halls, and accommodation amenities.
We have good facilities for our training. We have a very well equipped skills laboratory. This is for all the programs, both the basic diploma, the Kenya registered nursing, the midwifery, the critical care.
Nursing is a noble profession because we work with our clients at different stages of their lives, right from birth up to end of life. When a baby is born, a nurse is present. When a baby is brought to receive vaccines, a nurse is present. When you fall ill, the nurse is by your side. And even at the end of life, a nurse is present. So we are there to give our services throughout each stages of human life.
For more information, call us on 0732 163 164 or 0719 073 164 or visit our website at www.matakenya.com.
All right, it is the 6th day of August 2021. Good morning and welcome to this health talk show brought to you in partnership with it's brought to you by Capuchin Television Network in partnership with Mater Misericordia Hospital. My name is Sasha Elizabeth, and as usual, health being a very paramount thing in life, we enlighten you more about a topic, upper respiratory tract in children. Now, before we start, I have some guests, and allow me to introduce them to you before we move on. Dr. ODONGO, yes. Welcome. Please tell our viewer who you are and what you do.
Thank you very much, Elizabeth. Good morning, viewers. My name is Dr. Daniel ODONGO, and I'm a medical officer at the Mater Hospital. So like Elizabeth has mentioned, today we'll be talking about upper respiratory tract infections in children. We'll talk more. Thank you.
Welcome, and it's good to have you again.
Thank you.
Dr. Bernard,
yes.
Bernard, welcome.
Thank you very much. My name is Dr. Ramo Bernard. I work in Mater Hospital and actually at the emergency unit. Today, as you presented earlier, we talking about upper respiratory tract infection, especially in children, because this is really a bad time for children who are not able to wear masks in this pandemic.
Welcome, Dr. Bernard. And I am Sasha Elizabeth, your host as usual. And to start off, please tell us, it might really sound like a common word, respiratory tract. respiratory tract, but what is the upper respiratory tract, and what function does it do in the body?
Thank you once again. Now, a respiratory tract is basically the passage which offers air into the body. Okay, how oxygen from the atmosphere gets to our lungs through the respiratory tract. We basically split into two, upper respiratory tract and lower respiratory tract. Now, upper respiratory tract basically starts from the nose and the mouth, okay, because you can either breathe through the nose or through the mouth. And it goes up to the level of the trachea, okay, the upper part of the trachea. So that's called upper respiratory tract. The components are the nose, you have the nose, you have what you call pharynx, okay, which has three parts. The part which is just behind the nose, which is called nasopharynx. We have the part which is just at the back of your mouth, which is called oropharynx, and then the lower part which is connected to the what? To the larynx, which is a bit lower down. You are not able to appreciate on visualization with a torch, which is called laryngopharynx. Okay. Then from the pharynx you now go to the larynx. The larynx, it's what commonly you see from outside here. This is called Adam's apple, right? Yeah, in our local terms. But inside it, you have the what? You have what they call vocal cords. Okay.
So all that is part of the upper respiratory tract.
Exactly.
Okay.
And then connected to the upper part of the trachea. Then some of the basic functions of this is that, number one, some of them we obviously know. Your mouth used for eating, all right? The nose you use for breathing in, okay? The nose also has air follicles, okay? This air, some of these follicles, they trap away the dust because the air you're breathing in is dusty. It's always dirty. So its function is to trap away this dirt so that the air going to your lungs is clean. And also it also humidifies this air, okay? Makes the air a little more warm compared to your body temperature, because your body temperature is always higher than the external temperature.
Thank you, Dr. Bernard. Thank you so much. Now, Dr. Odongo, please share with us what are some of the organisms that cause upper respiratory tract infections?
Yeah, thank you so much, Elizabeth. I think first to start with, when we talk about upper respiratory tract infections, it means all the components of the upper respiratory tract that Dr. Bernard has spoken about can get infections. They can get inflammations. So that means we can get infection of the nasal cavity, which we call rhinitis. We can have infection of the pharynx, which he has talked about, which is called pharyngitis. We can have infection of the other components that are inside the oral cavity, behind the oral cavity. There's what we call tonsillitis, which is really a very common form of upper respiratory tract infections. And then we have laryngitis. So all these components of the upper respiratory tract can get infected. And one thing that I want to mention is that upper respiratory tract infection is most of the time caused by viruses. 90% of the times. Yes, there are components of infection which are bacterial in nature, but most of them are viral in nature. One of the most common viruses that cause upper respiratory tract infection is called RSV, respiratory syncytial virus. And then the other one is called adenovirus. Of course, at the current moment, there is a virus which is causing us a lot of havoc. Coronavirus is another virus that can cause upper respiratory tract infection. And then we also have influenza virus. These are some of the viruses that cause upper respiratory tract infection. But like we said, it can also be caused by bacteria, like streptococcus can cause upper respiratory tract infection. The other important organism that can cause upper respiratory tract infection, especially in children, is fungi called Candida. There's what we call oropharyngeal candidiasis. what we call, locally is called oral thrush. If you get a child with whitish card-like covering over the tongue and the back of the mouth, that if you scrape off leaves a red base, that is called oropharyngeal candidiasis. It is usually caused by fungi. So, but we also have to understand that there are allergic conditions which will make a child present with symptoms similar to infection, and yet it is actually allergy.
Okay.
So those are really the common causative organisms of upper respiratory tract infections in children.
Are there specific practices that predispose children to infection of the upper respiratory tract?
Yes, there is. Remember that children, most of the time, they don't take care of their hygiene. Most of them, they play together, they live together. Even currently, as people are supposed to put on masks, they can't put on a mask. So this really predisposes children to getting infected by other children. We know, like for example, in school, they are always together. They share clothes, they share cups, they share everything. So sharing causes direct contact between one child and another, and that causes them to get infected. And children, for example, you tell a child to always close the mouth and cough. They can't remember that all the time.
Sure.
So these are ways where children get infected all the time. And that makes me now come to the fact that, especially when children are in school, the number of infections in children really go up because of the kind of environment they live in, the way they take care of themselves when they are together.
Okay.
Yeah.
Thank you so much. Now, Dr. Bernard,
Yes.
every health condition exhibits some forms of signs and symptoms. Please share with us some of the common signs and symptoms of upper respiratory tract infection in children.
Oh yes. Now, starting from the structure of the upper respiratory tract, okay. If you are looking at the different parts which are infected, starting from the nose, if somebody has nasal infection, then these people commonly come with running nose, sneezing, okay, itchiness in the nose. Sometimes it goes up to the conjunctiva, the eyes that have tearing, fearing light, okay. And these are more to do with viruses, okay. The ones which commonly involve too much of running nose and the tearing eyes and the itchiness and nose, sneezing too much. Then when you go lower down, like to the pharynx, okay, you start having the things of feeling of scratchiness in the back of the throat, okay. Most viruses will come with those dryness in the throat. Then if it's more of bacteria, they tend to have pain in the back of the throat, okay, and also a lot of discharge. They feel like they want to clear some thick mucus from the throat, okay. Lower down at a lower level, they will have they start having breathing challenges, okay, start having breathing problems, shortness of breath, okay, fast breathing in these children. When a doctor examines, of course, will find they're struggling to breathe, okay, what we call subcostal recessions, because if the upper airway is obstructed, they'll struggle to pull the air in or take the air out, okay. They also start coughing, okay, at a lower level. The higher it is, the more it causes more sneezing. The lower it goes, the more it causes cough, okay. And the same infection can cause both coughing and also sneezing, okay. Then they start having problems swallowing because they start having pain, like people have children who have swollen tonsils, start having pain when they're swallowing food. They start refusing to eat, basically. Some of them, the mothers will come to us saying the baby is refusing foods, all the foods. Breast milk, they may still struggle to take, okay, but most importantly, refuse to feed. They start having fevers, okay. Yeah.
Okay, thank you. Now, how contagious is the upper respiratory tract infection in children?
Okay, I think let me start by adding something a bit about one of the components of upper respiratory tract infection called sinusitis. Sinusitis is inflammation of the sinuses. and sinuses are air-filled spaces within the front of the skull. They are supposed to have no form of infection. They are supposed to be air-filled. And once there is any infection in any component of the upper respiratory tract, they are always at risk of getting infected as well. And when children or even adults, when they get sinusitis, then some of the symptoms that you have spoken about also manifest. But one of the most important symptoms of sinusitis is a headache. That's sometimes frontal in nature. That means you get headache at the front of the head. And these are children that when they bend forward, they say they get more headache. They bend forward. It's because the air spaces are on the front of the head, around somewhere here and others around here. So when they bend forward, the inflamed sinuses get more painful. And if you try to examine such a child, if you touch the front of the head, they will say they feel more pain at those parts. And these are children or even adults who come with lightheadedness, and when they change position, the headache becomes worse. So you had asked about how contagious is upper respiratory tract infection in children. Like I tried to hint on it earlier on, it is very contagious because it is either airborne or droplet infection. Droplet infection means someone coughs and then the droplets that comes from the coughing or the sneezing or even talking, sometimes even singing, you know, those droplets that come from the mouth or from the nose, they have the organisms that cause the infection. So that means if these children live together, then definitely they are going to get to infect each other. And that's why overcrowding and living in areas which have less aeration is one of the things which promote infection.
Okay.
Yeah.
Thank you, Dr. Daniel. Now, you've mentioned the droplets and this being transmitted via air. Okay. So now this brings us to whatever we are going through right now. Like in the wake of COVID-19 pandemic, you find that some of the signs or symptoms of COVID are somehow related to the signs and symptoms of the upper respiratory tract infection. So what's your take on that? Because we've had some people saying they are keen or not, so they may be suffering from a different upper respiratory infection, but it was mistaken to be COVID-19. Could you please give your input on that?
Oh yes. Now, before we got COVID, we had a lot of upper respiratory tract infections, okay? COVID has just added onto the burden of the upper respiratory tract infections. Now, COVID, the signs and symptoms which COVID comes with, it is quite similar to other respiratory tract infections.
Absolutely,
okay?
yeah.
Now, you cannot distinguish that this child has COVID or this child has other upper respiratory tract infections by signs and symptoms alone. That's why it's always paramount that if you suspect that this child has COVID, you can only do confirmatory tests to see that this is COVID. If you want to confirm this upper respiratory tract infection is being caused by some particular bacteria, you have to take a swab so that you also tested in a laboratory. We're able to do that as well. If you suspect some particular viruses, some upper respiratory tract infections, that's the signs that they come with. They're a bit obvious to the doctors. He talked about candidiasis. If the child has oropharyngeal candidiasis, the way we examine a child, we shall recognize that this is highly likely is candida. But in general is that we cannot use signs and symptoms alone to say this is COVID, this is not COVID, or this particular upper respiratory tract infection is not this one. Sometimes even the virus plus the bacteria, they come alongside each other. You start with viral upper respiratory tract infection, then a few days later you get bacterial superinfection. So initially you're treating as a virus, but since the virus disturbs the immune defense system of the upper airway, then also bacteria will come and infect. Then the whole thing is mixed infection, okay? So I know the parents will get confused that this child was taken as having a virus. A few days later, they went somewhere, they found it was bacteria, and then they gave antibiotics, they improved. So that's how confusing it can be. So the doctors, the doctors, by examining these children, taking good history, and sometimes with some few blood tests, or sometimes if you highly suspect particular aggressive infections, like COVID, one of them, okay, some aggressive streptococcus, okay, you can take a swab of the area which is infected, then you test in a laboratory. That's how you can distinguish that this is this and not confuse with others.
Okay, thank you. Now, before we go to the kind of treatment administered or how to treat the upper respiratory tract infections, is there a specific age group among children that is more susceptible to infection of the upper respiratory tract?
Yes. Now, children who have started playing outside their homes, okay, these are children who are beginning to walk, run around, right? Who are playing, interacting with other children, and up to around 5 years. These children have, number one, their immunity is still building up. Okay, up to 5 years of age, the immunity is still building up for most infections. Then number two, they interact too much with other children who might be carrying the infection already, because they don't know who is coughing. They're not selfish. Children are they're so generous with each other. They play freely, so they easily interact and they spread infections all over. They share everything, sharing infections, much as they're sharing their fun, they're also sharing infections. So children between around 1 year up to 5 years, they really have high risk of getting a lot of these respiratory infections.
Thank you, Dr. Bernard. Dr. Dongo, what are some of the preventive measures that someone can adhere to maybe protect their kids against infection?
Yeah. So I think I want to add something little about what Dr. Bernard has just discussed about how we can differentiate other upper respiratory tract infections from COVID. Basically, COVID is a form of upper respiratory tract infection. So we can't differentiate until we test. That's the baseline. Exactly. We test, then we differentiate. But only that COVID, if it is becoming severe COVID, then it progresses to become lower respiratory tract. Exactly. If it doesn't progress to lower respiratory tract, we can't know until we test. So to differentiate, test. You don't test, you can't know.
Great. Okay.
Yeah. So yes, the question you asked is about
the preventive measures.
Preventive measures. Yeah. Yes. Upper respiratory tract infection, interestingly, it's very easy to prevent because the measures are very basic. They're very basic. They are not so demanding, but because we are usually not disciplined, even adults, we are not disciplined at observing the measures of prevention. One, we have talked about social distancing all the time. You know, do not make close contact with anyone if you're not sure whether they have any form of infection or not. This is because when someone coughs close to you, the droplets can get to you. So always stay at least 1.5 meters away from anyone else. And then two, in the era of COVID, put on your mask. Because when you put on your mask, even if you have the infection, you cannot, the possibility of you infecting another person is very minimal. Or if someone coughs and then the droplet was supposed to drop on your mouth or on your nose, but you will be on a mask, that infection will not get to you. And then the other one is adequate aeration. We have talked about through ventilation all the time. This helps whatever whatever organism is in the air to be taken away by the circulating air. So through ventilation is very important. And then the other one is those who are sick. If you think you're sick for any reason, you seek medical attention. Yes, I think we'll maybe talk about it later, but there's a lot of use of over-the-counter medication. I don't know if that is one of the things you wanted to ask us about, but
that's true.
Yes, so maybe we'll talk about it later. But if someone is unwell, go to the hospital, get treated so that we get to know
Is it COVID? Is it rhinitis? Is it allergic upper respiratory tract manifestation? So that we know exactly how to take care. And then hygiene. Hygiene is very important. Remember, we cough, we sneeze, and then these droplets fall on the cloth. And so if you touch it and someone else, maybe you're hugging someone, they touch your clothes, they touch their mouth, they touch their nose, they get infected. So hygiene, washing your hands all the time, and then washing all the garments, washing clothes, ensuring that you're clean all the time. These are really the basic measures, and they are not very demanding, but because we are not disciplined, that's why these infections are there all the time.
Not forgetting, now that COVID has come in, it has become of public interest that people get vaccinated as well. It's one of the ways we prevent. We don't only vaccinate against COVID. I know WHO already has a couple of vaccines for so many upper respiratory tract infections. Okay, we start from measles, going to pertussis, okay, going to whooping coughs, okay, we know these ones, okay, going to influenza, there are seasonal influenza vaccines we also give, okay. It's not so common for us here because I think we don't have them so aggressively, but in some schools here they also vaccinate children for influenza.
Thank you, Dr. Bernard. Now, time is against us, but I'll give you a few seconds to tell us how do we treat the infection of the upper respiratory tract. Please, Dr. Odongo, share with us.
Thank you. Yes. First, I want to say that the main aim, our main goal in treating upper respiratory tract infections is to take care of the symptoms and to improve quality of life. Because we said there is cough, sometimes there is fever, there is a lot of discomfort. So basically, our primary goal is to take care of those symptoms.
So you administer symptoms based on this treatment based on the specific symptoms.
Exactly.
Just like they were doing on COVID-19 patients. Yes. Okay.
Yes, because we know that 90% of the times it is caused by viruses. We are not going to give you an antiviral to kill the virus because most of the time it is on the upper airway anyway. So we want to take care of the symptoms so that your body finishes the fighting of the virus.
Thank you. Now, as we wrap up, please, Dr. Bernard, give your final remarks to our viewer.
Yeah. Now, the most important message you want to bring out is that upper respiratory tract infections is something we can prevent. There are so many, and they present in so many ways, and we can easily prevent with our basic good practices of hygiene and self-care and avoiding too much close interactions without wearing masks. Okay, mask has not only prevented COVID, it also prevented spread of so many upper respiratory tract infections, which we used to have so much. So when we wear our mask, we wash our hands with soap, we avoid too much close interaction with each other without a mask. Okay, and also emphasizing this in our families, we shall reduce the burden of upper respiratory tract infection, which are making parents spend too much in hospitals, okay, and government spend too much on this.
All right, thank you, Dr. Odongo.
Yes.
Parting shot.
Yes. I think I want to say that parents should stop overuse of over-the-counter medications, because most of the time it is the same medication we are giving all the time, and yet sometimes this is a different form of infection. And we are giving these same medications for so long that sometimes a child has very minimal symptoms that we can just watch. The child has just a mild running nose, no fever, no headache. We can watch. The body will fight the virus. But if the discomfort is too much, then yes, let the doctors see the children, other than going over the counter and buying medications, which sometimes can be dangerous to the child. And then the other one I want to say is that We at Mater Hospital, we have just received some doses of COVID-19 vaccine. So those who want second doses, not the first dose. Those who have received first dose and want second dose, they can come and get their shots. And then also, before I finish, Mater Hospital has a number of clinics within Nairobi, and some of our clinics have not been operational for some time. But now, as of now, our current clinic and Westlands are open even on weekends. So I encourage the community to come and get seen, to come and get information, come and have wellness check done, come and see our consultants, come and see our doctors, so that your health is taken care of. Thank you.
Thank you so much, Doctors Bernard and Odongo, for coming over. Thank you for being here and sharing important information on upper respiratory tract infection in children. I believe that in future we'll get time to speak about the same infections of the upper respiratory tract, but in adults. Right, doctors?
Yes.
Okay, thank you so much. It was happy having you here. Now, that's it now on our health talk today. And I was with Dr. Daniel Odongo and Dr. Bernard, both from Mater Misericordia Hospital, who have partnered with Capuchin TV to bring you this health talk show, just to enlighten you and also to remind you of the best practices that you are supposed to embrace in order to stay safe and healthy. Remember, it is health that is real wealth, and not pieces of gold and silver, as Mahatma Gandhi puts it. Now, as we wind up, I'd like to extend my sincere thankings and gratitude to the entire team that is working behind the scenes. That's Christopher Odhiambo, who is the camera operator. We have the sound engineer, Eric Otieno. We also have visual mixers, that's Prudence Rimba and Vicky Kasongo. And on the transmission desk, we have Peter Mwangi. Thank you so much, guys, for your joint efforts to make sure that this live show is successful. Now, I would like to thank you too, dear viewer, for taking time to view this. Right now, I would like to take you where another team is bringing you live happenings. And my name is Asasha Elizabeth. See you next time. Goodbye.
Catherine Macaulay Nursing School is a leading institution in Kenya offering competitive training in nursing education, innovation, research and professionalism.
We are a nursing school that was started way back in 1972, chartered as a midwifery school. The school is run by a highly qualified faculty. All the departments, for example, you look at midwifery, it's headed by someone with a PhD in midwifery. Critical care is headed by a highly specialized person with a master's in critical care. Nephrology, the same. Our clinical instructors for these programs are also specialized in their various fields.
The school is licensed and accredited by the Nursing Council of Kenya to offer holistic training in various nursing programs.
We have general nursing, that is the Kenya registered nurse. We have higher diplomas in Kenya registered midwifery, Kenya registered critical care nurses, Kenya registered nephrology nurse, and also we have theatre nursing, which is called Kenya registered perioperative nursing. We do admit our students from all over the country, especially for the basic diploma, that is the Kenya registered nurse program. And for higher diplomas, we admit, again, we have a Pan-African presence. We have students from Congo, from Rwanda, from Uganda, and from other countries. But basically, most of our students are Kenyan, those ones who have graduated from our Kenyan institutions.
Enjoy your learning in a friendly environment with adequate training facilities, including a fully fledged skills laboratory, library, lecture halls and accommodation amenities.
We have good facilities for our training. We have a very well equipped skills laboratory. This is for all the programs, both the basic diploma, the Kenya registered nursing, the midwifery, the critical care.
Nursing is a noble profession because we work with our clients at different stages of their lives, right from birth up to end of life. When a baby is born, a nurse is present. When a baby is brought to receive vaccines, a nurse is present. When you fall ill, the nurse is by your side. And even at the end of life, a nurse is present. So we are there to give our services throughout each stages of human life.
For more information, call us on 0732 163 164 or 0719 073 164 or visit our website at www.matakenya.com.